The opinions expressed on this show are those of the host and are not meant to diagnose or treat any particular medical issue. Always check with your doctor or eye care professional before making any changes to your vision care. Now the talk continues on Entertaining Talk Radio, NBC1260 and 96.1 FM. This is Healthy Eyes with Dr. C, live from the Best Buy studios at NBC1260 and 96.1 FM, every Saturday from 2 to 3 p.m. For many of us, our eyes are more than just a window to our world. They're part of how people perceive us, how we look, as well as how we see ourselves and others. There's so much more to Healthy Eyes than just their shape and color. Get in on the conversation. Call 480-423-1260 right now and find out how to keep your world in sharp focus for many years to come. Now with Healthy Eyes, here is your host, Dr. C.
7 minutes after the hour, we are live from the Best Buy studios at NBC1260, 96.1 FM. Welcome to Healthy Eyes. 480-423-1260 is the number to call. If you'd like to get in on the conversation, you have a question about your eye care, eye health. Again, 480-423-1260. And welcome to the show, Dr. C.
Hi, Mark. How are you?
John Chrysagas.
Nice to see you.
You know, it's nice to see you. Oh, I get it.
Oh, yeah. Oh,
everyone who's on the webcam is going, yeah, we see it too. And the folks behind the glass. Many of them behind the glass, and also there's some folks actually outside the studio walking by that's interesting that are interacting.
Yeah, but they can't see us, so we're safe. We're safe from that.
Good news for them sometimes. So we were talking on the show just before you got here, and you heard it on the way over and almost called in. Why is it that healthcare professionals don't make themselves available during the hours that are typically outside of 9 to 5, I don't want to call them bankers' hours because that's another industry, but why is it that a lot of businesses aren't available when people typically are off of work and they're more accessible or available?
Well, I think part of it's tradition. It's always been that way. You know, the doctors are open from 9 to 5, and that's how they practice. Now, I think things are changing, and it happened, I don't think with the economy, but as times change, I think people are realizing that they need to do things differently, and they're adapting to that change and the changing environment. For instance, now just things that we do in our office, and I'm not saying it's right or wrong, it's just things that we do only because the profession that I'm in, being in eye care, there's a lot of competition out there, and so people have a lot of choices, and we need to do whatever we can to make our patients happy and to make it as, effortlessly to get them to come in. God, I'm not going to say that word again. I'm not going to say that word again on the air. But nonetheless, we do have evening hours. We stay open until 7 o'clock 2 nights a week, and we do have Saturday hours. We're open from 9 to 1 on Saturdays. We do stay open during lunch. We don't close during the lunch hour. That way, people that have a lunch hour, that might be the only time during the day they can come over and get their stuff. We do exams during the lunch hour, but a lot of that is people coming in to pick up their glasses or their contact lenses because they have an hour to go do that, and they do that, and that way they don't take any time off of work. And so those are things that we do to make it easier for the patient to come in and see us. But I can definitely see people, doctors saying, I'm here 9 to 5, I have a family, I need to do this, that, the other, and quite frankly, some doctors don't need to do that to attract patients or to make it easy for their patients, because if they have such a specialty that, people have to come and see them, they can pretty much do whatever they want. And I'm not saying that's right. I'm just saying that's why they can do that. Where I think whenever you're getting into professions that are a little more competitive, they're going to do things to try and make it easier for patients to come in.
Is your industry competitive, very competitive overall, where a lot of people are involved in it? And what drive? We didn't talk about the business end of it, but
because you mentioned in the last show too, you were talking to the host about how each doctor's office is a small business, and there's no doubt that each office is a small business, but they don't teach us that. They teach us to do the doctoring part, which is great, and we need to do that. But then they want you to go out and practice, and that's why, let's say in optometry, a lot of people may work for other people because they don't want that headache, they don't want that hassle. They like to go in and see patients and then go home. And where those of us that have practices, we not only have to know the medical stuff, we have to know how to run a practice to make it to where we can, make a living out of it.
So your business has been around over 25 years. Right. What do you do that folks who have not been successful in that business do?
Well, I'm not going to say...
I mean, the hours, you talked about the hours.
Yeah, I'm not going to say folks aren't successful. They could be more successful, or if they're complaining because they're not busy enough, there are things that they could do to be a little bit busier. I think one of the things that we've done is we try to run a patient-centric office, to where most everything we do is to try and put ourselves in the patient's chair, and what would we do to try and make things better for them. Like I tell my staff all the time, I can't stand it when I go to a doctor's office and the doctor says, okay, we're going to do this, and then leaves.
Wow.
And then you don't know what to do. You're sitting there, okay, I'll put my clothes back on, and then the door's still shut, but no one's come in. Am I supposed to go out? Am I supposed to wait here? And I said, always tell the patient what you want them to do. If you want to follow you, tell them to follow you. Don't go walking down the hallway, and if they're not behind you, you got to go back. I said, tell them what they want done, because people are, I'm not going to say they're at our mercy, but people want to be told what to do as far as, what am I supposed to do next? Don't leave me sitting here. And even though we try to be patient-centric, things happen. We get emergencies, we get behind. I might have a 90-year-old patient in the chair that takes me a little bit longer, and I'm going to be behind. They have to be my first patient of the day, and I'm behind the whole rest of the morning. And I apologize to patients all the time if I'm running behind, because I hate running behind, but it happens. And so there are probably some people out there listening to the show that are patients of mine saying, patient-centric? I waited an hour to see you 2 weeks ago. That doesn't happen too often, but it has in the past. And we can apologize for it, and someday it might be them that was the emergency, and so they need to
That's
know
a really good point.
That can happen, and we don't plan it, and we don't double book. We don't do it on purpose. Because I know some people that will put too many people in, not hoping, but because they know some of them aren't going to show up.
It's like an airplane.
Yeah, and so we just can't do that, because if everyone does show up, then we're going to have a lot of unhappy patients. And
we're going to offer a free set of frames to anyone who wants to give up their appointment today.
Yeah, exactly. Yeah. Oh, no takers. Okay, now we got to add the lenses.
Oh, we'll add the lenses, and we'll give you an overnight stay and lunch at Burger King around the corner.
Exactly. So we haven't had to do that yet, but basically we just try. We're always changing. We're always trying to do things because the environment's changing, people's attitudes are changing, and so we're changing the way we, let's say, purchase contacts, so we can dispense contacts straight from the office if that's what the patient wants, so they don't have to come back and pick them up. We'll mail contacts to people so they don't have to come back and pick them up. Anything to make it easier for them. Outside of going to their home to see them. We just can't do that with the equipment, but whatever you can do to make it easier for them is what we try to do.
Can you imagine loading all that equipment onto like a van or something, driving up to someone's house and saying, step up to the...
I have loaded equipment into a van.
Have you really?
Not to go to a house, but I used to work, when I was first in practice, I used to work for the state, and I would go out into nursing homes and other areas, and other, let's say, access facilities throughout the state, and we would do eye exams on those days. And so we would be a mobile eye clinic, so to speak, and it was part of DES, and they gave basically it was an eye exam and glasses to people that qualified. And so I had an optician with me that would fit them with frames, and they'd make the lenses and go back a week or two later and give them their glasses. So I have been a mobile eye clinic before, and and those people, they were pretty appreciative of us showing up, because they weren't going to get anything otherwise. But
interesting. Well, 15 minutes after the hour, you're listening to Healthy Eyes on NBC 1260 and 96.1 FM. He's Dr. C, Dr. John Chryssagis. I'm executive producer Mark Shander. We are live from the Best Buy studios at NBC 1260 and 96.1 FM. Get in on the conversation. Ask your question about eye care and how to keep your eyes healthy for the rest of your life at 480-423-1260. We'll be back with more of Healthy Eyes right after this.
The doctors and staff of Tempe Eye Care Associates at 7511 South McClintock Drive in Tempe are committed to providing you state-of-the-art eye care services and products in a comfortable and friendly atmosphere. Remember the Bionic Man? We're not quite there yet, but we're not as far away as you might think. Through annual comprehensive eye examinations, the goal at Tempe Eye Care Associates is to not only maximize your visual performance, but to ensure and maintain your healthy eyes. As part of your annual examination, your visual acuity will be measured and a test known as refraction is conducted to determine your eye's refractive power. Further tests are performed to determine your visual coordination, muscle control, and focusing abilities. Your examination will include a comprehensive evaluation of your eye health to detect diseases such as glaucoma, cataracts, and retina and optic nerve abnormalities. The ocular health evaluation includes neurological assessments, measurement of internal eye pressure, and a thorough examination of the internal and external structures of the eye. Tempe Eye Care Associates also offers the OptoMap Retinal Examination System. OptoMap allows many patients the option to forego dilating drops by providing an ultra-wide view of the retina. While it doesn't replace dilation in all patients, it's an option for many. After performing these tests, their doctors will discuss your results and, if needed, explain your prescription and give you a better understanding of your overall eye health. Traditional options such as glasses, contact lenses, and eye medications will be discussed, as well as any other options you may need to consider. Dr. C is available to assist you personally, so you know you're getting the best available eye care, even if you're not on the Valley's basketball, baseball, hockey, or football teams. You'll see better after you see Dr. C. To make an appointment to visit Dr. C, call his office right now at 480-967-4910. That's 480-967-4910. Help keep your eyes healthy regardless of where you live in the Valley by starting with a call to the office of Dr. C. 480-967-4910 today. 480-967-4910 or visit www.tempeeyecareassociates.com. That's www.tempeeyecareassociates.com.
Now the talk continues, and you're just a phone call away on entertaining talk radio, NBC 1260 and 96.1 FM. Welcome back to Healthy Eyes with Dr. C. Every Saturday from 2 to 3 p.m. Arizona time. Get in on the conversation. Call 480-423-1260 right now and talk about your healthy eyes on the air. Once again, with Healthy Eyes, here's your host, Dr. C.
20 minutes after the hour, and we're back at NBC 1260, live from the Best Buy studios. The number to call in is 480-423-1260. That's 480-423-1260. Give us a call if you have any questions about what we're talking about or any questions about your eye care. This is Dr. C, John Chrysagas. I practice at Tempe Eye Care Associates. Here with the big producer of the show, Mark Shander.
Literally.
No, he's the big kahuna, so we have to give him the rights to that. But what we talked about last week... Pardon me?
That was nice of you.
Well, I have to be nice, at least on the air. But last week we were talking about the eye exam. I realized we've been on the show. We've been out doing the shows for about 14 weeks, and we never really talked about the eye exam itself. We talked about why you shouldn't be afraid of one and not worried about the dilation and things, but we never really talked about what we did. So it took us the whole hour to get about halfway through the eye exam because we start talking about different things that come from that, which is great. That's why we do this, because we want people to understand it from a perspective of you as a patient and the layman, not rather than a doctor here saying this is what we do and how we do it. So Mark's pretty good at being a layman, and But no, he asked very good questions, and questions that a lot of you probably would ask, which makes me feel better about not getting a lot of phone calls, because I figure Mark's asking the questions you'd asked anyway. That sounds pretty good, doesn't it?
Yeah, because I try to figure if I was listening to the show and was a layman, like I'm not, because I'm not an eye care professional, but I play one on the radio.
Yeah, but so do I.
But seriously, what would I want to know? What would I want to hear? And these are questions in a lot of cases that people just don't ask because they don't have access to somebody who's, I already used the word access, but as accessible, someone who's going to be open and honest. They go to an eye care professional, and it's like there's a little bit of tension in between. There's a little bit of anxiety. It's like somebody's going to look at my eyes. They have the opportunity to potentially make my life really not comfortable or very comfortable, and it's like it's a trust issue. And so it's good to be able to just ask the questions that people are thinking and just usually don't have the ability to ask because they don't have that accessibility. And it's good to have this show for that.
And anything we do most typically is going to be a very short-term discomfort, if there is any. But a lot of the things we do are going to have the potential to be I'm not going to say be life-changing all the time, but they're going to put you in a position where you're going to see better, and maybe your contacts are more comfortable or something along those lines, to where we're going to put you in a better place. And so it's just something that it's nothing to be afraid of. It's just something that you do. But the other problem that we have is if people are seeing okay and their eyes aren't hurting, they don't come in. It's kind of like a dentist. You should come in every 6 months for a teeth cleaning. How many people actually do it? If they look good and they're not bothering me, I'm not going to go in. So we fight that all the time, because there are different things you can do preventatively for dentistry, obviously. Well, there are things you can do with your eyes too that a lot of people don't understand. So they figure if they're seeing okay and they're not bothering them, we're not going to go in. And as long as they're young and healthy, that's probably okay. But there are certain things, as we said a long time ago in this show, that you don't want, just because the status quo is going well, you don't want to necessarily not get things checked out.
I think another thing that really surprised me was the first time you mentioned to someone who called in that it was okay to wear readers as long as they had a recent they had seen an eye care professional and kind of got a clean bill of health from that. And
yeah, if your eyes are healthy and you had the eye exam and you got the same power in both eyes and you don't have any astigmatism and we think those will work, again, are they the best quality? Are they made specifically for your eye? No. And so you might wear them and you might get headaches because they're not made for you and you're sensitive to that. But if all you need is some magnification for a short period of time to put them on, I don't have a problem with people doing that as long as that's what they're for. But don't fool yourself if you're getting headaches and you're doing it. Yeah, I saved a bunch of money, but but I got headaches from it too. So good luck with that one. But getting back to the eye exam, we'd gotten to the point where we did all of our we'll say pre-testing and all the preliminary stuff, and now we're actually going to start looking at the eye, because the last thing we talked about was the refraction. And the best thing I can say about a refraction was that's the better number 1 or number 2. As soon as I say that, people know what I'm talking about, because everyone dreads the making that decision and the being put in a position where, oh God.
Well, if I tell you the wrong thing, I think it was okay, but it might have been blurry. I was a little tired. I teared.
I'm not going to see out of these glasses for the next year if I don't give you the right answer.
Yeah.
And, so a lot of people take that to heart and they stress over it. And, I just try and put them at ease and say, just, take it easy and just tell me what you see. Because we talked last week again, too, about the bracketing and how if I show you two and you can't tell the difference, we're done. So you can always just take your time, ask to see them again, and you'll get there. But as far as the exam from that point, we start doing a more physical part of the exam, or we're starting to look at the health of the eye. And we start with what we call the external exam, where we're looking at the outer structures of the eye before we go to the internal structures. And so we can do that we can do some of those things with the naked eye, but most often we need to use the microscope. We call a slit lamp, because it's a slit of light that comes out, and you put your chin on the chin rest and you look into the machine, and we just go back and forth with this light, and we're looking at the front of your eye. So we're looking at the lids and the lashes and the tear film.
So you're looking through a little slit. Is that the right thing? And then around you?
No, we're looking through binoculars, basically. Okay. We're looking through...
What's the slit part of it?
The light that's shining on your eye. We can make it a wide beam, or a full circle, or we can make it a slit. And 90% of the time we have it in a slit formation, because we can just move right across the cornea and see the different layers of the cornea. And so we call it a slit lamp, because that's basically, it's just a term that they use, because it's a slit of light that's shining on the front of someone's eye. And so but that allows us to go from one end to the other. Typically, like in my the way I do things. I would do the right eye first and go to the left eye. And, just by nomenclature and just by habit, you do that so you don't ever forget anything. And so every once in a while, I'll have a patient that comes in with an emergency and they got something in their left eye or their left eye's bothering them. And I'll put the slit lamp on and I start with the right eye and move across. And they're like, no, it's the other eye. I'm like, yeah, I know, but I always look at the right eye first because we just have, you always want to make sure everything's okay, even if they don't have a complaint in that eye. And so even if the right eye was bothering them, I'd still look at the right eye first, but I'd still always look at the left eye because that's what you do.
It's what you do. It's the process.
You just,
it's like, no, you're not looking at what I told you. It's wrong. I told you.
They never really say anything if the right eye hurts and you go there first, and then you go to the left eye and take a look. But a lot of them will say something. If you look at the right eye, like, no, you weren't listening. It's my left eye. So, we move across and look for the structure, the function, and make sure everything's working okay. Any dryness, lid disease. There are a lot of what we call blepharitis out there. That's an infection of the lids, where if you see people and their eyelids look all red and puffed up, that's typically a long-standing chronic type of infection that people can have of their lids, called blepharitis. And the other thing we can see a lot is a lot of people don't realize that the lower lid is a spot where we get a lot of carcinomas, a lot of skin cancer on the lower lids. And it's because if you think about that, especially the lower lid and the way it comes up and then it kind of goes into the eye, there's a little shelf there. And that shelf is a great spot for the overhead sun to just pound on.
Interesting.
And so if you're not wearing sunglasses, that's just getting a lot of ultraviolet radiation there. And so a lot of exposure on that area. And so the lids, especially the lower lid, is where we see a lot of skin cancer. And most of it, some of it can be quite aggressive. A lot of it is just things they can take off and it doesn't create a problem, but a lot of them can be rather aggressive. So we're always looking at the lids, especially here in Arizona on the lower lid to see what's going on there. And I mentioned the cornea. The cornea is the most powerful refractive component in the eye, and that's the center of the eye. It's the dome that goes over the colored part of the eye. It's where what a contact lens rests on. It's what's going to get hit if a piece of metal comes into your eye. It can hit the white part of the eye, but it never does. That would be too okay. It's got to hit the cornea because the cornea. I read something once where the cornea has more nerve endings per square unit area than anywhere else in your body other than the nephron of the kidney, which is why a kidney stone that's about this big, and this is a pinpoint I'm making with my fingers, a kidney stone that's about that big feels like it's like a bowling ball going through the insides of your body. Well, same thing with a corneal foreign body. When you get something on your cornea, it'll bring you to your knees. It can be very painful. That's the bad news. The good news is because it is so well innervated, it can heal itself up pretty fast. And so, it'll be pretty painful, but then gradually get better. And within a couple days, a lot of times you won't even have any pain because it heals up so fast. And so we're looking at the cornea to look for anything that might be wrong there, any scars from previous infections, previous traumas. If I see something, I might say, you ever get hit in the eye? Or do you ever have something, this, that, and the other? They'll remember that they got, a BB in the eye at age 6, or or they had a real bad eye infection.
Cat scratched them.
Something. Yeah, a lot. Because if it goes deep enough into the cornea, it'll leave a scar. And so it's 30 minutes after the hour. We're going to take a break. If you have any questions at all, give us a call when we come back. It's 480-423-1260. It's 423-1260, and we'll be back.
Come on, Lisa. Let's go before it gets dark.
Well, we haven't talked to everybody yet. Why do you want to go so soon?
You know I don't like driving at night. The lights on oncoming traffic and reflections are just awful.
I'll drive back tonight. I have my anti-reflective lenses with me. I don't have that problem.
Works for me. Let's get some more food.
Later that same evening.
Okay, everybody, smile for the camera.
Wait, I need to get my glasses off. They always reflect the light, and I don't like the way they look.
That's it. You're getting anti-reflective lenses, too.
Yahoo!
It's easy to remember to ask for Kodak lenses.
Hi, I'm Mark Shander, executive producer of HealthyEyes. Every Saturday from 2 to 3 p.m. right here on NBC1260 and 96.1 FM. Your eyes are more than just your window to the world. They're how other people see you and sometimes see right through you. Find out how to protect your vision with the latest technology in eye care this Saturday from 2 to 3 p.m. right here on NBC 1260 and 96.1 FM.
Transitions Optical is dedicated to promoting healthy sight worldwide. Transitions lenses do more than correct and protect vision. They enhance the way you see everyday life. By adapting to changing light conditions, they bring out the best in all that you see, so life looks more vivid, more vibrant, more true. Transitions lenses are the #1 photochromic lenses recommended by eye care professionals worldwide. Protect your eyes and learn more about Transitions lenses by visiting your eye doctor or transitions.com.
Now the talk continues, and you're just a phone call away on Entertaining Talk Radio, NBC 1260 and 96.1 FM. Welcome back to Healthy Eyes with Dr. C. Every Saturday from 2 to 3 p.m. Arizona time. Get in on the conversation. Call 480-423-1260 right now and talk about your healthy eyes on the air. Once again, with Healthy Eyes, here's your host, Dr. C.
32 minutes after the hour. Glad to have you with us. This is John Chryssakis, Dr. C, talking to you from NBC 1260, the Best Buy Studios, 96.1 FM for those of you that want to go to that side of the channel. Give us a call. I won't give you the phone number because the announcer just did, but give us a call if you have any questions about eye care or your eyes. I'll be happy to answer them for you. We're discussing the eye exam and what it is we do as we go through the eye exam. And we just finished talking about the cornea and working out front, and I was talking about how sensitive it can be when you get something in there, or even if you don't get anything in there, you can go skiing and spend too much time up at high altitudes, and you got a lot of sunlight. You're not wearing your sunglasses, and you can cause some damage from UV. You can get a UV burn on your cornea, which that hurts like heck too. Kind of same thing with a welder's burn. It's the same basic type of thing.
Does that heal? I mean, you don't have like a...
It'll heal, and most often, again, unless it's not too severe, most often if it's superficial, you're gonna remember it. It's gonna hurt, but it'll typically heal without scarring. But again, the deeper it goes, the more potential you have for a scar that we'll always be able to see. But more often than not, it's just an experience that you will never forget because it'll hurt. And
I usually equate stuff to broadcasting. So, I don't know why, but it's like a hobby thing. But in the olden days, we used to have tube cameras, and you would have a burn-in, and you would have something that would, you might hit the corner of a light off of a reflection or something, and if you didn't pan off of it right away, and when you panned, you got this little streak thing usually, and you knew it was a tube camera because there's a little streak going on. Yeah. It doesn't happen in CCDs or MOS sensors today.
How about radio?
But, I don't know. We'll have to look up there and see if it's on the webcam. But, yeah. So, the idea is these tubes would burn, and they were very expensive. So one of the things they used to do to correct the burn is to actually burn the whole rest of the tube to try and have it match the level that the tube was burned, and burn the other good tubes, because there's 3 tubes in a camera, the red, blue, and green, the primary colors, and you would burn the tubes to try and match the level of burn that you had so that you wouldn't have to buy a new set of tubes if you could do it. Yeah. And what would happen was the camera would then be much less sensitive to light, and you'd have to open up the iris a lot more. And it didn't always work, but if you needed it, it was an emergency, you had a concert or something, you had something that you absolutely had to have it for, you kind of did this damage to match the damage kind of solution, and the tubes were never the same. Is the eye ever the same in that case where something's happening?
It can be, but depending, again, on how severe the problem is. I mean, the cornea is awesome in its structure and in the way it can heal itself up. And a lot of times I'm going to say the vast majority of corneal problems, it'll heal up and you won't know it was there, and it's as good as new. However, if it went too deep and you have too much damage, LASIK, not as much, but the old RK, when they make radial incisions, I think I had my record in the office this week. I saw a patient that had 30 incisions in one eye.
Wow.
30 radial cuts in the eye. And that's going to cause distortions and things that aren't going to go away. That's not ever going to go away because, again, they're deep cuts. It's going to cause scar tissue. And so, or if you get hit in the eye and it with a foreign object and it goes pretty deep, we're always going to be able to see where that was and where it went and how deep it went, because it's not going to ever go away. But even with that, everything around it can heal up and be in good shape. And so we can see some pretty serious scarring in a cornea and the patient still sees 20/20 if it's not in the center. And even if it is in the center, the vision's going to go down, but they'll still have some vision. So it can regenerate very well. But there are, again, just like everything else with the body, some things will heal up perfectly well, and other things it'll heal up, it'll never be as good as it was before.
So here's a tough one then. What portions of the eye do we have the technology to be able to replace? And what portions of the eye do we not yet have the technology to be able to replace? So, I mean, the promo that we have running, we just heard it, we're not at the $6 million man level yet,
right?
But we're not that far away.
Yeah, but if I remember right, that was your quote, and,
not yours.
who did we say the layperson was in this? But because number one, we probably do have the technology, but it probably does cost more than $6 million. But no,
it sounded cool.
There are a lot of
people listen to the show if I say this.
There are a lot of things that they can do now, and now they've been able to do some things for a long time. Like you can replace a cornea. You can have a corneal transplant.
Okay.
If you have a real bad scar on the cornea, or you've got a condition like keratoconus or Fuchs dystrophy where the cornea is just not working and is becoming opaque and you can't see out of it, they can, in essence, take a plug, let's say, out of your cornea and insert another donor cornea in there.
But they're not taking any fat out of your rear or anything.
No, it's not. They're not trading. They're not trading anything. It has to be a totally clear tissue. It's not a. It's a transplant, but it's the same tissue from someone else. And because if you took it from anywhere else, you'd have a nice blob of it couldn't see through. But nonetheless, the corneal transplants are evolving and progressing to where they're much better now than they've ever been. So for someone that does have a diseased cornea, a corneal transplant is a life-changing procedure. And, again, we don't do those as an optometrist, but corneal specialists, there are a lot of corneal specialists around the valley that do great jobs with corneal transplants. The one we've never been able to do anything on is the retina, because the retina is basically neural tissue. However, they're doing some study came out about 3 weeks ago that I read that they did some stem cell surgery in UCLA. Some ophthalmologists at UCLA are doing some work with, I can't remember the retinal, there's a Stargardt's disease or one of those retinal, genetic retinal diseases where they did they went in and made a change to the retina with stem cells, and so they're going to see how that goes. But so it's amazing how as time goes on, they're going to be doing some extraordinary things.
Do you see the day when we'll have CCD or MOS chips in our eyes that we could actually replace the retina and maybe even have some sort of super lens to be able to
I would say them? 5 years ago, I'd have told you were nuts. That there's no way they'd ever be able to do that.
Tell me that today anyway.
Yeah, and I still might tell you that. But but as far as that aspect is concerned, I wouldn't be surprised. I mean, they're working with contact lenses with chips in them. They're working with contact lenses that have medication in them. I think I talked about it.
Really? So you can release medication from a contact lens?
One of the biggest problems we have with glaucoma is compliance. The vast majority of people that have glaucoma are older. And whether it's because they forget or they can't because they have a slight bit of shakiness and they just can't get the drop in their eye, and they live alone, or they don't have a caregiver to put the drop in their eyes. And so they're not getting the medication in their eyes. And the non-compliant patient, for whatever reason, whether it's because they can't, they forget, or they just don't want to, because again, glaucoma doesn't typically hurt. So, why am I taking these drops? They're expensive, they bother me, they burn. But if they don't take the drops, they could go blind. Well, they're working now with a contact lens that will slowly release, let's say, a glaucoma medication.
Wow.
So that wouldn't be a contact lens they necessarily put on for vision, but if they needed it, they could probably put a prescription in there. But the main reason for it is to put out a medication, or they may have a contact lens, you have an eye infection. We want to make sure we have a constant amount of antibiotic on there, because basically when you put drops in there, you're getting a big dose of antibiotic, and then over the course of the next 2 or 3 hours or 4 hours, depending on how often you're putting it in, the concentration is obviously going down. Well, if you put that medication in a contact lens, it's time, a slow release, you'll always have a constant amount of antibiotic in the eye helping to fight off the infection. So yeah, they're doing all kinds of stuff that it's just amazing.
Wow.
But we don't have those yet, but they're coming.
So it could be as much as or as little as 5 years away potentially, do you think?
The contact lens, yes. As far as the retina stuff, no. But
But we'll start with a retina that's more like back we were talking about the video cameras of the past, where they're kind of like tubes as opposed to solid state devices.
Yeah, well, they're just anything they can do because you're dealing with the retina that takes the light and turns it into an electrical impulse that goes down the optic nerve to the brain, to the occipital cortex, and that's where sight happens. Sight doesn't happen in the eyes; it happens back in the occipital cortex, and then through some miracle, we see this picture, and they talk about the image being inverted on the retina and this, that, and the other. But when we see it, it's right side up, and it's just an amazing process of perception and how the brain takes all these electrical impulses and turns them into sight. So it's a very difficult thing to just make, but they're doing some stuff that's pretty wild. So we're getting there as far as doing things like that. But
so getting back to the exam,
and I wonder why it took us so long to get through the refraction last time. But it's okay. I mean, you have these questions, and so it's good that we're answering them. After the cornea, we look at the conjunctiva. The conjunctiva is basically
How can you say it without laughing?
I could say it without. I mean, it's because it's something I say every day, but it is kind of a funny word. But basically, the conjunctiva is the clear tissue that goes over the white part of the eye. If you look at the white of your eye, that's not the outer layer. There is a clear tissue that goes over it that typically you can't see very well. But if you ever have an allergy real bad,
I was going to make the joke that it's showing, kind of like your epidermis.
Yeah, your epidermis is showing. Yeah. But the conjunctiva, you can see it really well if you ever have an allergy in your eye. Because it starts to swell and it gets very.
What is it? What part of your eye is it?
It's a clear tissue that goes over the white of the eye.
Okay, so it's just you don't see it.
You typically don't see it because it's nice and smooth. But if it swells up and it starts to retain water because of some inflammation, allergies.
I didn't realize that the white of the eye wasn't just exposed; that there was anything over it. That's
why we're here. Conjunctiva goes over the top, and but if you have an allergy, it'll almost. I have some patients where the white that fluid or that clear tissue over the white of the eye is almost oozing over their lower lid because it's so swollen and so congealed. And again, as it heals up, it'll go away. Or if you have pink eye, another word for pink eye is conjunctivitis. It's an inflammation of the conjunctiva. When it starts getting red and inflamed, it's not the sclera, it's not the white part of the eye that's basically red. It's the conjunctiva, the tissue over the top. That's where the blood vessels are. That's what gets engorged.
That is where the blood vessels are.
Yeah, and so that's why if you've ever seen someone that has blood on the white part of their eye, not just the redness, but blood. That's what we call a subconjunctival hemorrhage. The blood is underneath between the conjunctiva and the sclera, and it happens that one of those little blood vessels just happened to get a leak.
And can it happen from an impact?
It can happen from an impact. Almost always it's spontaneous. It's going to be something that increases pressure to the head. I mean, the first thing I'll ask someone that comes in with that, because they're scared. There's blood right there, but it's typically it's nothing to worry about unless you had a skull fracture or something. But typically I'll ask if you had an episode the day before of vomiting, sneezing, coughing, something that brought a lot of pressure to your head. I'll say, as a matter of fact, I did. Or did something fall on your chest and create a lot of pressure to your head? Do you have allergies and you're rubbing your eyes a lot? It can be from, I have some patients that as they get older, they have a blood pressure problem. They get a spike in blood pressure, something might pop there. But more often than not, it's from rubbing the eyes or something that makes it happen spontaneously. And it looks terrible. And I tell them that, and I know they go down the street to the next doctor to get a second opinion because it looks so bad. There's got to be something wrong here. But more often than not, it's going to take a while to reabsorb and go away. And but it's really nothing to worry about most of the time. But that's where the blood congregates, is between the conjunctiva and the sclera. And it's 45 minutes after the hour. I got everyone telling me it's time to take a break. But we'll be back shortly because, last time, I think these breaks are getting shorter all the time. I didn't even have a chance to catch my breath.
This is a long one. This is the one for your place again.
Oh, it is. Oh, so this is a long commercial. So be sure and listen, and because it's a great subject matter. So we'll be back after a few minutes.
The doctors and staff of Tempe Eye Care Associates at 7511 South McClintock Drive in Tempe are committed to providing you state-of-the-art eye care services and products in a comfortable and friendly atmosphere. Remember the Bionic Man? We're not quite there yet, but we're not as far away as you might think. Through annual comprehensive eye examinations, the goal at Tempe Eye Care Associates is to not only maximize your visual performance, but to ensure and maintain your healthy eyes. As part of your annual examination, your visual acuity will be measured and a test known as refraction is conducted to determine your eye's refractive power. Further tests are performed to determine your visual coordination, muscle control, and focusing abilities. Your examination will include a comprehensive evaluation of your eye health to detect diseases such as glaucoma, cataracts, and retina and optic nerve abnormalities. The ocular health evaluation includes neurological assessments, measurement of internal eye pressure, and a thorough examination of the internal and external structures of the eye. Tempe Eye Care Associates also offers the OptoMap Retinal Examination System. OptoMap allows many patients the option to forego dilating drops by providing an ultra-wide view of the retina. While it doesn't replace dilation in all patients, it's an option for many. After performing these tests, their doctors will discuss your results and, if needed, explain your prescription and give you a better understanding of your overall eye health. Traditional options such as glasses, contact lenses, and eye medications will be discussed, as well as any other options you may need to consider. Dr. C is available to assist you personally, so you know you're getting the best available eye care, even if you're not on the Valley's basketball, baseball, hockey, or football teams. You'll see better after you see Dr. C. To make an appointment to visit Dr. C, call his office right now at 480-967-4910. That's 480-967-4910. Help keep your eyes healthy regardless of where you live in the Valley by starting with a call to the office of Dr. C. 480-967-4910 today. 480-967-4910 or visit www.tempeeyecareassociates.com. That's www.tempeeyecareassociates.com.
Now the talk continues, and you're just a phone call away on entertaining talk radio, NBC1260 and 96.1 FM. Welcome back to Healthy Eyes with Dr. C. Every Saturday from 2 to 3 p.m. Arizona time. Get in on the conversation. Call 480-423-1260 right now and talk about your healthy eyes on the air. Once again, with Healthy Eyes, here's your host, Dr. C.
11 minutes till the top of the hour at NBC 1260 and 96.1 FM. You're listening to Healthy Eyes. We are live from the Best Buy studios, and this is the flagship of a new network, and it's actually going. It's pretty exciting. By the end of next week, we should be somewhere between 3 and 10 new radio stations picking up your show.
Wow!
So that was kind of. You sound very enthused.
I can't believe anyone's listening other than you and I.
Well, we maxed out the webcam earlier, which was kind of cool. I don't know what it is now because I shut down the computer.
No, that's my father getting on 50 times.
Calling up his friends. Look at
No, I'm telling you, he's got on 50. It never works, so he just keeps getting on. But
I actually did a screenshot. I had never seen that happen before, but interesting. So anyway, we got to the point where we kind of got off on a tangent about.
No, you got off on the tangent. I was politely letting you wander, but no, we were talking about the conjunctiva and how you started seeing, you started laughing, but we finally got through the conjunctiva and the and red eyes, and that typically when the eye gets red, that's what's getting red is the conjunctiva. So that's what gets pink with pink eye, and red when you have an eye infection or you have a trauma. And so the So the conjunctiva is very vascular, and that's why it picks up everything. Oh, come on now. So then we move back. Now we're to the iris. And the iris is the colored part of the eye. And we've talked about that numerous times, so I'm not going to waste too much time on it. But obviously, we're looking at the color. We're looking to see if the color is uniform or if because some people have different colored irises.
Does it mean anything when your iris is not a consistent color?
Yeah.
Or if it changes colors?
Yeah, it can. And sometimes it's normal for that to happen. But there are some conditions where you get heterochromia. Heterochromia means different colors to where my eyes were always brown, and now all of a sudden I got this green eye and this brown eye. Where typically I've seen a lot of people where their brown eyes will change to green as they get older, or things will change, and that's okay. Where it's when they start to change differently, or you start to get some pigment that is getting darker in one area, and it's getting because you can, since there is a lot of pigment and there is melanin, you can get melanomas or nevi on the iris, and so you want to make sure that it's just a normal type of freckle and that it's not doing anything else that it's not supposed to do, because you know. How do
you test for that? Like, do you do a biopsy kind of thing?
Well, no, we wouldn't, but basically we look at something, and if we start to see something that's getting bigger or starting to get vascular, where blood vessels are starting to grow into it, we would refer that to the appropriate. Whether it's an eye care, it might not be an ophthalmologist, it may be an oncologist, depending on what's going on. But yeah, they'll do whatever they have to do to biopsy it or get a piece of the tissue to see if it's something they need to remove.
Are there oncologists that will specialize in the eye?
That's a good question. Anyone I send to is always an ophthalmologist, but I have had ophthalmologists send patients on to other oncologists. Whether I don't know of any that just do ocular. That's all they do is some type of oncology.
Is it rare?
Yeah, it's rare, but it's like we say with everything in medicine, not just this, but it's not rare if it's in your chair. If you've got someone with that condition, it doesn't matter how rare it is, you got to take care of it.
It's not rare if it's in your chair.
It is so true that you can read in a book, or you can Google something now and read about it. And I remember reading about that in school, and you see it, and 1 in 50,000 people are going to get this. It doesn't matter if that one person is in your office. You've got to figure out what to do and get them to the appropriate person to take care of it. And so, but that's the iris. And now still at the external exam, we're looking at the lens. And the lens is kind of where we go internal and external, because we talked about the lens with Dr. Bluth a few weeks ago in cataracts. But that's basically what we're looking for in the lens. We want to make sure that the lens is clear and that it's refracting well and there's nothing else happening to it. And we can see a lot of that with the slit lamp from the front. But if we want to get a good look at the lens, we're going to dilate and look through it with other lenses too. But because whenever we look at the back of the eye, that's when we shift into the dilation, where we're going through the pupil, looking at the back of the eye, and so we make the pupil bigger to take a look at that. But we can see the lens pretty well without a dilation. It's part of the external exam. But then we'll look at the lens again after we dilate to look at the internal structures of the eye, which is where we go to now, as far as the shifting now to look at inside the eye. And we can still use a slit lamp for that, but you have to use a lens. We have to look through a lens and the slit lamp to get us to the back of the eye. And that lens doesn't work too well unless the patient's dilated. Undilated pupil is just going to get too small. And when we don't dilate, we're looking with what we call a direct scope. And a direct scope is monocular. You're only using one eye, so you don't have good depth. And you just don't see things as well because of that small pupil, which is why we get back into the why people get dilated. And if you're 25 and I saw you last year and dilated you and you did pretty well, and I don't see anything wrong this year, do I have to dilate you? I'd say no. An asymptomatic young person that I just did a dilation on, I'm not going to say I have to do it all the time. But the older you get, or the more pathology there is, or the higher your prescription, or the more factors you have that we have to watch out for different things, more often than not, we're dilating people most every time we see them, or doing the OptiMap so we can get a good look at the back of the eye.
Talk about the OptiMap is it OptiMap?
It's the OptiMap, or Optos is the company that makes it. Some people call it the Optos. In our office, we call it the OptiMap.
And it's a picture that you take of the back of the eye.
Yeah, it basically gives us a picture of the back of the eye. It is something. It is not the panacea. Does not replace dilation. In a lot of cases, there are some patients that I will do both on. If I dilate you and I see something that I want to take a picture of, I'll still take a picture because sometimes I want the documentation. But I have 2 retinal cameras. I have the Optos and I have another one, depending on what I want to get a picture of and what type of clarity I need, let's say, or if I need to look at something. The Optos can also give me different views at different layers of the retina. But what the Optos does is, for someone who says, I can't get dilated now, I just can't do that, I can't take the side effects, I have to be able to read, I'm going to work, or this, that, and the other. If we do an Optos on them, again, it doesn't replace dilation, but it gives us a much better picture than an undilated exam does, because we can still get depth. We go out a lot further with that than we do with just a regular direct scope. And so again, even though I have an Optos and I've had it for 9 years, or an Optimap, I should say, I still dilate the vast majority of my patients, just because there are different things that the Optos isn't going to see. But it's a great screener for people that don't want to get dilated, but we don't have to have them back to dilate. If we do that and we get a good enough picture.
As we found out, there's not an app for that.
There's no app for that.
Interesting.
Not yet. Who knows?
Yeah.
Again, we've been talking about that a lot today too, about things that are coming on and things that they'll be able to change. But they might have an app I can stick up.
They won't come out with an iPhone 5, but it'll be called the new iPhone.
Yeah. The iPhone.
With an app to look at your retina.
Yeah. So I'm going to take my phone. I'm going to not only text with it and show you pictures. I'm going to put it up to your eye and do an eye exam and look at the back of your eye. What do you know?
Interesting.
Yeah. So, but nonetheless, as we look at the back, if we move our way back through again, from front to back, as far as the internal eye, we're going to look at the lens again, check for cataracts. We're going to go to the vitreous. The vitreous is the large gelatinous fluid in the back of the eye. Probably about 70% of the volume of the eye is the vitreous. That is where you see the floaters. That's where floaters come about. Floaters are typically, they can be from other things, but floaters are typically when that fluid, the thick fluid, congeals and condenses on itself and forms these things, these fibrils, these amoeboid-shaped things that just kind of float around in that fluid. And as we get older, that fluid tends to get less gelatinous. It begins to liquefy, so you get these things moving around more, so you see them. If you've seen floaters, a lot of you have seen floaters before, and they become monotonous, and they become a nuisance. But typically, you learn to deal with your little friends, and you know when they're going to be there and when they're not, and what you have to do to get rid of them. But there's something we can talk about, and we can pick up with that at next week's show, because it's getting close to the end. So how can we get a hold of you if we need to talk to you this week?
Well, you can go to www.shander.com, and I'll point it back to you.
Yeah. But you can talk to me at my office. Our phone number is 480-967-4910. It's Tempe Eye Care Associates at McClintock and Elliott in Tempe. Our website is www.tempeeyecareassociates.com. For those of you that don't want to type that much, www.drsee.com. We decided to get both of them done because you got to have TempeEyeCareAssociates.com, because that's the name of the office, but Dr. C makes it so much easier. Nice. And they can get on the website and ask a question, or just maybe they'll get their answer on the website.
And the youngest patient, you'll see?
The youngest patient I will see is typically about 3. But I think a lot of kids need to be seen before that, and so that's the pediatrician seems to think that's needed. They can either be seen by a pediatric optometrist or a pediatric ophthalmologist.
And so on the flip side of that, is there any particular age when you don't need to take care of your eyes anymore? I hate to say that, but
no.
There's some people who think, I'm too old to go in to have this look.
That's when a lot of this stuff happens.
What if you've never been to an eye doctor before? Is it still okay to go in when you're...
Yeah. I mean, there's no doubt. You have to.
Okay. And your phone number once again?
480-967-4910. Have a great week.
See you next week on Healthy Eyes.